This demonstration is how to operate the chair. On both sides of the chair, you have the buttons here on the side. The last button is to bring the chair down. The first button is to bring the chair up. So you want to check the occlusion, the patient's occlusion, so the occlusal plane should be parallel to the floor. So right now it's not. We need to bring the occlusal plane parallel to the floor. So I'm going to show you how to adjust the headrest. So behind the headrest, there's a latch. So you're going to pull the latch back and bring the headrest forward. You're going to lock the latch in place. Okay, so the occlusal plane, it should be parallel to the floor depending on how high the height of the clinician. So it should be between your shoulder and your elbow, depending on how you have your chair set up. So this is the x-ray unit. This is the unit. You're going to find the unit like this when you come into the room, and this is how you're supposed to leave it before you exit the room. This is its position when it's not in use. This is the arm of the unit, and this is the tube head. On the tube head, you have the focal spot. You have one in the front and then one on the side. So the focal spot is always going to be positioned up, facing up. You're going to place the arm of the unit behind the patient. There is a switch on the bottom of the unit, the screen button. You're going to press it to turn the machine on. So I have the plate positioned in the mouth to expose it. So now we're going to expose the x-ray. So you're going to close the door for the exposure. For the demonstration of the maxillary anterior, looking at the chart, the exposure setting for anterior maxillary is 0.20. So on the control panel here, we're going to adjust the time. Then we're going to expose it. This is our exposure button. So you're going to press the button and do not let it go until the cycle is over. It's very important for you to keep your finger and hold it the entire cycle. Let's say that you didn't and you get an error message because you let it go, it will look like this. So you're going to get this error message. So that means that you either have an image on the plate or you don't. So we don't know because we don't know at what point you let the button go. So you're just going to take the plate out of the patient's mouth and scan it. To clear this error, just press either the up or down button. So on the windowsill, you have unexposed area and exposed area. So before you start the assignment, you're going to have your plates on the unexposed. After you expose them, you're going to drop it in the cup. So after you expose each view, you're going to drop it in the cup, and then you're going to scan. So you're going to grab the cup and you're going to open your plates and put them in the transfer box. So the barrier has a little notch in the center. You're going to pull it apart, tear the barrier open, and you're going to put the blue side down into the box. So let's say all these were exposed, so we're just going to place them with the blue side down. You can put them on top of each other as long as the blue side is down. And then close the box completely. And we're ready to scan. So you do not want to put them like this because the blue side is the sensitive side, so the light is hitting the plate. So when you go scan, this part of the image is going to be lighter because it's being exposed to the light. So always make sure that the blue side is facing down. Now ready to go scan. So do not enter the scanning room unless your plates are placed in the transfer box. You're going to log into Axiom. So you're going to click on Rolodex. And you're going to type in your virtual mannequin patient, the one that's assigned to you. I'm going to type in mine, but you're going to put yours in. You're going to select it, double click on the name, make sure that you see it on the bottom of the screen. Then you're going to click one time the X-ray icon. Only one time, very important. Be patient. If you double click it, you're going to get, it's going to freeze on you. We're waiting on the blue circle to disappear so we can activate the scanner. So once the blue circle disappears, you're going to select a template. So you're going to go to the drop down box here and select FMS 20. You're going to capture a new series. Then you're going to activate the machine. So if you notice, the scanner is on, but the lights are not illuminated. So once we activate the scanner here, these lights will illuminate. So you're going to click the scanner here to activate it. Then you're going to see the green circle. So now the lights have illuminated on the scanner here. So on the scanner you have number 1 guide and number 2 guide. So we have number 1 plates. So we're going to use the number 1 guide and we're going to scan it in the guide here. So you're going to open your box and you're going to scan the plates in the number 1 guide with the blue side towards the scanner in a vertical position. You're going to place it into the slot and push it all the way down. So the light's going to turn orange. So do not scan any more plates until the light has activated to green again. So you can use the other guides to feed the rest of the plates. So once you have scanned all your plates, you're going to pick up your plates from the scanner tray and put them back in the box. Close your box. And then you're going to exit. Close your Axiom, the X-rays. And then you're going to click Do Not Approve. Do not approve. And you're going to log out completely from Axiom.